Good morning. My name is Elizabeth Lottie, and I am the Director of Narrative Medicine at OHSU in Portland, Oregon. And I am just really excited to be here with you guys today, virtually, and then a little bit later um, in our own Zoom meeting. So thank you so much for being with me here today, and for inviting me to speak. So I'm going to be talking about narrative medicine and leadership. So the first question that I usually get asked is, what is narrative medicine? Um, and narrative medicine is basically any sort of medicine or healthcare that's practiced with narrative competence. So then you ask me, but what is narrative competence? And narrative competence is the ability to listen, absorb, metabolize, and be moved to action by the stories of illness. This is the definition that Dr. Rita Sharon put forth in her sort of sentinel article in JAMA almost 20 years ago. And I like to add to the definition and say that that narrative competence is the ability to listen, absorb, metabolize, and be moved to action, not only by stories of illness, but also by stories of wellness. Susan Sontag once famously wrote that we all hold passports to the kingdom of the sick and the kingdom of the well. We don't necessarily know when we're going to have to use each of those passports. But it's our stories in each of these kingdoms that really make us who we are. And as physicians, we need to recognize that the kingdom of the well is where most of our patients' stories are the brightest and the most telling of who they are as individuals. So, why do stories matter? Why is this important? Why is it important to know that the chest pain is happening in a father on the eve of a son's graduation or a trip to see an old friend, or that the chest pain reminds the patient of their own mother and her heart attack many years ago? Or that the patient is a plumber who works with pipes and leaks and blockages every day. Why does it matter what the stories are of this person's life beyond the story of the chest pain? Um, well, because beyond the bleeding and the seizing, I think we need to know that the complex lived experience of the person facing a health problem is the background. And if we don't, we miss the real reasons that that person is coming to visit us. Their symptoms, certainly, but also their fears and their awareness of their own fragility. So here's the question that I really get asked when I tell people that I am the director of narrative medicine. They say, but Elizabeth, give me a concrete example of what narrative medicine looks like. So I am going to give a couple examples, and then we're going to talk a little bit about why this is important for leadership. I think that exploring the lived experience with patients really needs a completely different script than the HPI that we're used to. And one way to do this is by introducing a third object. So something that is not happening within the hospital room or within the clinic or within the setting of where you're experiencing this encounter with a patient or with colleagues. So this third object, it could be a poem, a short text, a line of poetry, a photograph, a work of visual art, or it can even be an opportunity to create and use what is created in that space. And that by doing this, we open up the lived experience in a way that asking our scripted questions doesn't quite allow us into. So let's talk about our first patient. You find yourself standing outside a patient's door and you're hesitating to go in. And so I want you all to think back to a moment where you, for whatever reason, stood outside a patient's door, not wanting to go in. Maybe you were uncomfortable, maybe you were angry, maybe you were frustrated, maybe you didn't know how to connect with this person. But for some reason, you had just a little clutch in your throat before you walk in the door. I want you to remember what that felt like. I'm going to tell you a story of a moment that I had that same feeling. I was standing outside a patient's room about to go in and was having trouble thinking about how I was going to connect with this person. He'd been in the hospital for several weeks and was in because of either a second or a third episode of acute endocarditis, secondary to IV drug use. Was difficult to engage with from my perspective. So I walk in the room and a friend of the patient is sitting next to the bed. And as I come in, the friend gets up and is on his way out the door. And the patient tells me, "Oh, Dr. Lottie, that's a friend from before." And I asked him, well, a friend from before what? And he said, well, he's a friend from before everything started going wrong. And so for me, what I started to, what just popped into my head was a line from Shakespeare that had just sort of been knocking around in my brain. And so I just said it. I looked at the patient and I said, "Those friends thou hast and their adoption tried, grapple them to thy soul with hoops of steel." And he looked at me kind of funny and he said, "What?" And so I said it again. "Those friends thou hast and their adoption tried, grapple them to thy soul with hoops of steel." And this time I actually walked over to the whiteboard, you know, the one where the vital signs and the plan for the day and the today's date. And I erased everything on the whiteboard and I just wrote this up there. So I want you to think about what happened here. If we were all in person, I would ask you to tell me what you thought. What is it that happened here? I want to just stop and think for a moment about something that I heard in a graduation speech that Atul Gawande gave to, I don't know, probably Harvard Med School. He had some bits of advice, and one of his bits of advice was to ask an unscripted question. And his point was to find out about the person behind the disease or behind the role, somebody walking down the hall in the hospital. Ask an unscripted question and try and find out a little bit more about who they are. And as much as I love his advice, I think it falls a little short. I think we need to ask enough unscripted questions until we find common ground. And the humanities and narrative medicine is one way to do this. Whether it's a poem or a line from Shakespeare or an image, there are questions to ask until you can find that shared thread. So I go back to what happened here. And for us, that third object, that line from Shakespeare that was now visible on the whiteboard, was a way for us to connect around the idea of friendship. I had had friendships, he had had friendships, and everybody who walked in the room and read that has the universal shared experience of being a friend and having a friend. And this quote on his board allowed my patient to connect with everybody who walked into his room and saw this up on the whiteboard. He felt connected not only to his friend, and it made him think deeply about his friend and how important that person was, But it also made me feel connected to a patient that I was struggling to find connection with. Um, and I think it's a great example of how oftentimes healing can happen in the margins or in the interstitial spaces outside of our biomedical model. And this is an example of that. This is an example of narrative medicine. So, how is this related to leadership? You may be asking yourself, this is a leadership conference. What does this have to do with leadership? And I think in order to answer that, I want to spend a moment with this definition up here. And I'm not going to spend a whole lot of time on burnout. That's not what this talk is about. But I think that this quote really captures something that I think is important. So this is from an article in The Atlantic, so not from a medical journal. But Dr. Gunderman says, professional burnout is the sum total of hundreds and thousands of tiny betrayals of purpose, each one so minute that it hardly attracts notice. And I think that if we want to remain human, to remember that we are humans taking care of humans, that we need time, space, and opportunity within our professional environments to recognize what it means to be human and to think about what our purpose is, and then what those betrayals of purpose are. And then perhaps more importantly, what those affirmations of purpose. So this is what I've done to this quote, is that I've kind of turned it on its ear, and I've made it say professional fulfillment is the sum total of hundreds and thousands of tiny affirmations of purpose, each one also so minute that it hardly attracts notice. And I think that this is really where leadership comes into play, because as leaders, we can integrate moments of reflection and pause and connection amongst the people who are doing the caring. So let's talk about a second patient. Your team on the wards walks into a patient's room. You gather around the bedside, you ask your questions, you examine the patient, you answer any questions that the patient and family has, and you talk about the plan for the day and you leave. And let's say your team is made up of a medical student, a pharmacist, a nurse, a resident, an attending, an intern. And as you walk out, you pull out from your white coat pocket a couple of index cards, a stack of index cards. They're easy to fit in your pocket. As far as I'm concerned, the index card is sort of the unsung hero of narrative medicine. They barely take up any space, and you'll see that the power of the index card can be pretty great. So you ask your team to write down 6 words. Write a 6-word story that captures the experience of being in that room. Everybody was there. Everybody experienced a similar thing. Now you ask them to write their 6-word story. And you give them 1 minute to do it, right? So it doesn't take a lot of time because rounds are busy. Everybody is busy. But while they're doing that, you might remind them of this famous 6-word story by Ernest Hemingway, which is "For Sale, Baby Shoes Never Worn." And you realize that you can really pack a punch in 6 words, and that you can communicate a lot, and you can evoke a lot of emotion, and you can do so in a short amount of time with a very few words. So The reason I say infamous is that it's been a little bit debunked that Ernest Hemingway actually wrote this story, but it's attributed to him. So we're just gonna go with that. Um, everybody finishes writing something down on their index card, and you ask each participant standing around in the circle to read what they wrote on the card. And the first person says, reminds me of grandfather, too soon. Prostate cancer, goes to bone, USMLE. The next person, thirsty, losing weight, pressure ulcer, turn. Next person, have 10 more patients, hurry up. Next one, old man, dying. Why am I so sad? Too many medications, confused, scared, alone. You might notice that some of these are more than 6 words, and that's okay. When you give someone an instruction, uh, we're not going to make a big deal if they're under 1 word or over by a couple words. So what has happened here? Again, if we were in person, I would ask you to raise your hand or just speak up. What do you think happened here? Well, since we can't have this conversation, at least not yet, I'm going to tell you what I think happened here. And that is that everyone in the group, you perhaps as the leader of the group, you receive these 6 word stories. You acknowledge each person that wrote one of the stories. And you recognize that each one is different, despite the fact that you had a shared experience. You may notice something about the patient that you hadn't noticed before when looking at it through somebody else's eyes, and that's wonderful, that's important. But I want you to focus right now on the team. Um, After hearing each one of these stories, you know each person a little bit better. And this is where, as leaders, I think narrative medicine can be useful and so beneficial. If you're the leader in that group, you now know a little something about each one of those team members. And I'm going to actually go back to this slide, right? So reminds me of grandfather, too soon. Well, maybe that's an invitation to connect about how we bring our personal feelings and experiences into the professional setting. Prostate cancer goes to bone, USMLE. Well, I bet that's the medical student. And maybe they're thinking really, really a lot about a test and not so much about the person or the experience in the hospital. And that's okay. It's just something to notice. Um, Thirsty, losing weight, pressure ulcer, turn. Perhaps that's what the nurse wrote. And you, as the attending physician, aren't thinking about how often this patient needs to be turned or whether that's something that's really high on your priority list and you're looking at this patient now with new eyes. We could go through each one of these, and kind of imagine what each person is thinking. But as the leader of that team, you're able to enter into the experience, the shared experience that people are having in a way that when you walk out of a room and just say next patient, you're really not having those opportunities to do that. Um, so just another, to kind of just drive home the point of the importance of this. Craig Irvine, who is one of the narrative medicine faculty at Columbia University, he writes, in order to care for others, one must not only master the pathophysiology of illness, disease, and disability, but also understand their meaning, both for the patient and the provider. And I think this is really important because as health professionals, as professional caregivers and doctors and nurses and nurse practitioners and physician assistants, we are very focused on the patient, and we're very focused on the meaning of the experience for the patient. But we also have to really pay attention to what the experience of caring for others means to us. Dr. Irvine goes on to say, to become a doctor is to become ever more human. And I think that to be a good leader, you have to recognize that you are leading humans, and also that you yourself are a human, and that to not recognize the stories of all of the people on your team or in your environment is really a missed opportunity. So, what if you're looking at me saying, but I'm not a poet, I'm not an artist, I'm not a writer, I don't have random Shakespeare lines knocking around in my head? That's okay. And I would also say that you are. Everybody has a creative side to them. Whether it's a musical side or a poetry side or a woodworking side or a doodling side, or an inventor side, or I can match my socks in the morning or choose the right shade of lipstick side. There's always some sort of creative impulse or energy in all of us. And I also think that it isn't so much about being a poet or an artist or a writer. It's really that the same way that we can learn how to read an EKG, the first time you saw that, it was a bunch of squiggles. We can also learn how to observe. We can learn how to observe a work of art, or we can learn how to read a poem, and how to recognize ourselves in these third objects, and also to hear and appreciate other perspectives from the people around us, and to connect on a more human level in order to fortify and strengthen our teams, which ultimately fortifies and strengthens the care that we're able to give to our patients, which ultimately is why we're all here in doing what we do. So we're going to look at this painting. And again, if I were in person with you, I would ask you, what do you see? So I'm going to ask you that now. I want you to look, just keep looking. What do you see? What makes you say that? And what else do you see? Think about what stands out to you. What do you see first? What do you see next? What do you see when you look a little bit harder? So since we can't do this together, I am going to imagine some of the things that you might see. And this list of words is based on looking at this painting with other groups and picking up on the words that they shared. And so I think, everyone can wonder why they see what they see and why different people see different things. And everyone can also appreciate a little bit of our own humanity that we bring to the table or the exam room or the team meeting as as an extension of what we bring to a painting. So where somebody sees blue, somebody else sees blood. And where somebody sees broken, somebody else sees hero. And where somebody sees dripping, somebody else sees stripe. And where somebody sees a handprint, somebody else sees a hawk. And we all see what we see, but in hearing all of these other words that people are bringing to it, we also start to see something a little bit different. And I want you to go back to that patient room where everyone saw the same patient and heard the same interview, but then left with 6 different stories. And looking at a work of art or reading a short poem is a different experience for each person individually, even though you may be looking at the same thing. But just like the patient, every team member can benefit from hearing what other people have to say and what other people saw or what other people heard. It's an opportunity to recognize what bubbles up in yourself, to reflect on what you hear from other people, and ultimately, it's a way to connect. And as a leader, it's really important to find ways for your team to connect so that you can collaborate and be effective team members. Um, and remember these definitions. So when you provide the opportunities to notice what is happening around you, whether it's a painting on the wall of your hospital as you walk by, a family member sitting alone in a corner, or a poem in your pocket or a Shakespeare quote on a whiteboard, you're also providing opportunities to connect with your own affirmations and betrayals of purpose, and to connect with each other around those tiny moments and details. And I think that leadership that doesn't recognize that teams are made up of humans um, will struggle to lead effectively. And on its flip side, leaders that recognize the multitude of perspectives and contributions are then able to harness that collective knowledge and the collaboration of the people around them. So we're getting close to the end of this part of our time together this morning. And I just want to make a note that I asked all of you to read a story before our breakout sessions today. And you may wonder why I chose that story, 25 Things I Know About My Husband's Mother. Well, I chose it for a couple of reasons, but one is that I just love it. And sometimes a story just, hits you in the right way and sticks with you. And so this is one of those stories for me. But I also chose it because of its form. And I'm sure that you noticed this as you read it, and you notice it from the title. But it is a list. It's 25 things I know about my husband's mother. And I think lists are great ways for all of us in healthcare to think about entering into something. Because we all write lists, right? I write like 20 lists a day, it feels like. And I never really thought about lists as being an invitation to create something beyond a practical or functional thing. But when I read this story, I realized that a list could tell a deep and moving story about someone else's life, even if the narrator has never met the subject of the story, which is another thing that's really interesting about this particular one. So I want you to think about that story that you read. What stands out to you? And in case you aren't making this connection, this is another way of me asking, what do you see? It's like looking at that painting. What do you see? What do you hear? What stood out to you in the text? So take a moment to think about the story. Was there a bullet point or one of those lists, numbers that was particularly meaningful to you? Was there a word or a phrase that stood out? When we connect live in a few minutes, we're going to continue this conversation, but I want to just sort of start to get those creative juices flowing. And so I think I'm going to end with this. Why do we want to be aware of what we notice and what other people notice? I think it's because ultimately we want to connect. And connecting in our world of health and illness means a lot of things to a lot of different people. It means being present for our patients, certainly, but it also means being present for our colleagues and for our learners, and also recognizing those stories that really come up for ourselves individually. And as leaders and future leaders, I hope that you come away from this talk and from your breakout sessions with some real world examples of how individual narratives can contribute to our collective experience. And that short intentional activities can really get you there. So I look forward to connecting in our Zoom space shortly. And thank you so much for joining me today.